Good Monday morning. Welcome to all our family members and friends of Singer Family Chiropractic. And of course, it's time for your weekly health tip. We had such a great discussion group on Thursday. It was about the 3 options that you have whenever you have any kind of health issue. So I'm going to kind of just summarize it as quickly as I can. So you have any kind of health issue, whether it's asthma or allergies, or whether it's depression, or whether it's low back pain or headaches, or ADD, or digestive problems, or heart conditions, or high blood pressure, or high cholesterol, whatever, okay? So there's basically 3 things you can do. Now, before we do that, we have to set the ground rules. Understand that the treatment of disease is the purview of medicine. Medicine is the treatment of disease by any means possible. So if you're actually treating a disease, now that could be cancer or that could be lower back pain, it doesn't matter. That is the purview of modern medicine. Now, chiropractic takes a whole different approach. We don't treat any disease. Well, Dr. Singer, you do treat low back pain. No, we don't even treat low back pain. Basically, chiropractic is built on the foundation that our body already has what it needs to be healthy. That we have what we call an inborn or innate intelligence that's responsible for healing us, okay? You cut your arm, in a couple of minutes, the arm heals, okay? Without you having to do much of anything. That's what we're talking about. The power that made the body heals the body. So the job of the chiropractor is absolutely not to heal or to fix anything whatsoever, regardless of the condition, regardless of the name of the condition, or even it doesn't even have a name. The job of the chiropractor is to make sure that this inborn or this innate intelligence is flowing throughout your body, nerve flow. That everything up here, all the instructions for healing up here are getting to all the different parts of the body. Why would they not? Well, sometimes the spine goes out of alignment and it puts pressure on the nerves, what chiropractors call a vertebral subluxation, and it prevents the messages from getting through. So wherever that nerve goes to, there's going to be a problem. If that nerve goes to your digestive system, you have digestive problems. If that nerve goes back into your head, you have sinus problems or headaches. If that nerve goes down your arm, you have numbness and tingling, or tennis elbow, or problems with the rotator cuff, or carpal tunnel syndrome. Wherever that nerve goes to, every organ, every gland. So by means of the chiropractic adjustment, by removing interference in this nervous system, we open up that flow. The body's innate intelligence is responsible for healing. Boom. Okay. So that being said, whenever you have a problem, there's 3 ways you can go. Chiropractic, medicine, combination. A lot of people choose chiropractic because it's the least invasive. We've always said chiropractic first, drug second, surgery last. Now remember, chiropractic does not heal, does not fix anything. But people that go to the chiropractor say, you know what, maybe if my body is functioning better, maybe if my body is functioning or working at a higher level, it can take care of this problem. And that's why people go to the chiropractor, regardless of the disease, regardless of the problem. And what's beautiful is that today's chiropractors are well trained to know whether it is, and I put this in quotes, a chiropractic case, meaning that we are well trained to know whether, you know what, we just need to get you to the hospital, we need to get you to the medical doctor. This is, as we say, above our pay grade, okay? We're trained to know that. Or if it's okay, to give the body some time to take care of this particular problem. How long? I don't know, a week, a month, 6 months. That all depends on the patient. That all depends on you. So the first thing is try chiropractic, get the body working better, see if it takes care of the problem. Now, one of the beautiful things is because your body's working better, a lot of other problems tend to go away and you're healthier. So regardless, this is a really great way to go. The second one, of course, is modern medicine. You know, say, I've got to get rid of this right away. Modern medicine offers typically drugs, surgery. Sometimes those are necessary. Sometimes the chiropractor, him or herself, will recommend that if we feel like, well, this is a surgical case. And I've done that in my practice too. Sometimes things have just gone on too long and are way too serious to give the body a chance to heal. Sometimes we need that intervention. In the Bible, it says that the spirit is willing, but the flesh is weak. And what that means is, in chiropractic, we talk about the body has a limitation of matter. So what that means is, even though the spirit, even though this inborn or innate intelligence wants to fix it, we're dealing with flesh and blood, and sometimes we need that intervention. So that's number 2. Number 3, amazingly, is a combination. People say, well, you know what? I know I need chiropractic. I know that's going to help me in the long term. I know that I'm just going to be so much more healthy being under chiropractic care, but I've got this serious thing that's going on and I need some quick relief. I need somebody else to take a look at this besides the chiropractor. And I know in our office, we're very, very happy to what we call co-manage the case, to basically talk with the medical professional and to come up with a plan, chiropractic and medicine together, so we can help make you whole. So sometimes people need that other thing besides being under chiropractic care. And that's not a bad choice at all. In fact, there have been many times that while someone was under chiropractic care, I've sent them out for medical consultation. I've also sent them out for other things like physical therapy, for acupuncture, for massage, things that are less invasive, but something I felt that they needed in addition to what we're doing here in this office. So, our talk was about 40 minutes. I tried to give you the gist of what that was all about, and hopefully this made some sense to you. If you have any questions whatsoever, please feel free to give us a call here at the office. It's Singer Family Chiropractic in Boynton Beach, Florida. Our number is 561-739-9500. We always do complimentary consultations, which means you can come in, you can talk with me, we can see where we're at. And, I have to tell you, I probably get maybe about 70-80% of the information that I need just from hearing you talk to me, just from, listening to what you say about what's going on and to see if it's a good fit. And then, of course, we usually do an exam, maybe even take some spinal x-rays. At that point, again, depending on what we find out from the consultation, from what I ask you, questions I ask you, and answers that you give to me. So anyway, thank you so much for tuning in. Have a wonderful week ahead. God bless you and your families. And it's Halloween, so please, if you're trick-or-treating, I don't even know if that's a thing anymore in 2020, but please stay safe, please stay healthy, and have a wonderful, wonderful week ahead. See you next week. God bless you and your families.